everyone. It's Tuesday, April 28th, and it's a beautiful day, pandemic, and feature our patient access team. And first, we're going to hear from Lee Bond about the statistics today.
Only one positive today, 212. We're excited about the flyover. Appreciate our friends at Keesler. It's going to be about 6:30, 6:45.
Yes, 6:30. We'll be up there on the roof waiting for them to come around at 6:45.
Cool.
So you've got patriotism. I think that they'll like.
I wore my red, white, and our military family and communities here. We're so lucky to live in such a great, very strong military community. But today, like she said, we're going to talk to patient access. Interestingly, Deanne is like just a few months ago, or years ago, quite long ago, Deanne was the first person that I actually worked with at Singing River. I sat right beside her, and during that time I was like, Deanne, you got to work harder.
I do, and I told you I am working as hard as I can. I'll never forget the memory.
So tell us a little bit about how during this pandemic, patient access has risen up to the occasion.
Absolutely. So, with any pandemic comes new challenges, and my team has stepped up and risen to the challenge in amazing ways. We put the call out from its extra assistance on being outside here with new screening stations to make sure we're getting questions asked of everybody before they enter the building, and my team is manning those with big smiles on their faces and awesome customer service. But actually, Lee, I've got members of my team right on inside.
Let's
who
go
can
look.
walk us through patient
Take us
access
in.
a little bit more.
Patient registration.
That's correct.
What actually does patient access mean? Like, what does that stand for?
Sure. Well, patient access refers to basically any step that's needed to get somebody inside of our facility. So it goes all the way from the point of scheduling through insurance verification, registration, and ultimately financial counseling if needed, if anybody needs to talk to us about those services.
So we're going to meet a few of those people.
We are. Today we've got Tiffany, who's one of our amazing schedulers, and she's going to tell us, she's also been a screener, so she can tell you about that.
Tell us how you've been keeping people safe in your other part-time job.
Well, upon arrival, we actually ask a series of questions. We ask if you are experiencing any symptoms. If you answer yes to any of those questions, we have you call our hotline at 809-5044. Also, upon arrival, we will check your temperature, and that's just to take extra precaution for everyone.
Thank you, Tiffany. So let's go check out this thermo camera we've got installed here just for the screening process. We've got our nice system right here.
All right, so this is a thermal cam, and what we do whenever you come in, we ask you to stand on the blue tape here, enough distance away, and then we just point and shoot. It'll give us a spot temperature up top, and we add a few surface degrees to that, just to make sure that we have you, taking preventative measures to get that we get that temperature for you.
Well, thank you, Jessica.
So one more way you're keeping patients safe.
One more way we're keeping our patients safe.
So I'm at 94.7, so our two add.
We're gonna add about 3 or 4 degrees to that, so we're gonna get you at like 98.
She's
A little bit below average.
She's below average. Sarah, you're below average.
I work too hard. Well, thank you. And so how else, being a patient access representative, you may be working the camera today, but during, normal business hours where we're not going through a pandemic, what is your role here, Jessica, in getting people their medical information to them and all logged into our system?
Well, we streamline that process by giving our patients the option to get all of their information at Singing River Health System /MyChart. That gives you access to your medical records, any kind of payment information you need. You can schedule and manage appointments from there. And it's also just a good way that if we're not available for whatever reason, you can get whatever information you need from us online.
Absolutely. You also can get your same-day lab results, radiology imaging, all through there that goes right to your doctor. So make sure that streamlines your care and we take good care of you.
Absolutely.
So now we've got Moya, who works normally right down the way here in the emergency department.
And Shirley, who's one of our financial counselors.
Shirley from financial counseling. So I think the question we wanted to ask of you, Moya, was tell us about what's changed during this COVID pandemic. What are you doing different than you normally do?
Well, not too much, just some more heightened awareness as far as our already consistent procedures that are set in place, as far as our cleanliness, as far as the safety and the care of our patients. So in that way, we are still encouraging our patients, of course, to social distance themselves, as well as to continue to present themselves to the ED. We're here to care for them on a COVID-19 basis or on a non-COVID-19 basis.
Thank you, Moya. And patient access, they are within every department here. And like she said, she's on the ED, so she's been through it all and has seen everything that comes through our doors. What do you think is the best thing about your job?
The best thing about my job, working in the emergency room department, we are the first immediate contact, which, in my opinion, I think is the best place to be in the ED. That we are the first to make contact, to get that information, to get to medical staff member to help treat them.
Yes, teamwork always wins. Core value number 6.
It does, and not just helping them in emergencies, but also we've got Miss Shirley here who helps people with their financial issues. So Shirley, tell us a little bit about how you help people with their financial health, I guess you'd call it.
Well, first of all, we like to make sure the patients are cleared first. We verify the coverage first of all. We get authorization on all required services. We also have self-pay patients that come in.
Well, that's good. So if somebody comes in and they don't have insurance, we don't turn them away. We figure out a way to help them, right?
Right.
That's awesome.
Yes.
Super cool. So you set them up on
We
payment
have
plans?
payment plans, we have patient assistance, we have self-pay, we have a 70% discount if paid in full within 10 days. We have
Bank loans or something y'all do for
we
people?
have bank loans as well to the local banks. And like again, we have the assistance program through the hospital.
And we have Change
And we have
Healthcare.
Change Healthcare that also.
So what does that mean? So
comes in.
somebody comes in and they're maybe eligible for what, Medicaid or something, or how does that work?
Change Healthcare, right, is another program that comes in to assist patients with Medicaid and also other government programs as well.
Right, so no one should ever not feel like they need or deserve healthcare service because it's too expensive. There are ways that we will work with you to make sure that you are provided the best care and taken care of appropriately.
So I think aren't there a lot of people that are eligible for Medicaid and don't even know it?
That's
How
correct.
often do
That
people
are-
come in and
right.
you help them and they didn't even know they were eligible for Medicaid and disability and things like that?
And quite a few of you we had the program at the hospital set up for this,
Right. So they come see you and you'll hook them up?
Yes.
Awesome.
Absolutely.
All right, Dan. So what's going on, and what's next here in patient access? You guys pretty much make everything streamlined together. You are in different facets
Teamwork.
of every part of our health system. What would you like to say to the public? To kind of explain what patient access is and.
Sure. Well, Patient Access is here to make sure that every single person that enters our doors understands that they are a guest in our home. It speaks directly
Core
to
value 1!
It speaks directly to core value number 1, is that our patients are guests. You're not just a number with us. We are here to make you feel like a part of our family, and we really value you being here. So thank you for choosing us when you choose Sooner River Health System.
You guys have a great team. I want to change the name of your department from to guest services instead of patient access.
Let's
Since
do
we
it.
call our
Let's
patients
do it.
guests, and you're here to help them in every way financially and keeping them safe. The emergency department through outpatient registration. I think we should change your name to guest services.
Let's do it, Lee. I'm all on board.
All right, me and you, we just decided.
We got it.
All right.
So even
So
though.
we're excited to spend a few minutes with you guys. You're awesome. We love you. Without patient access, you're the entry point to this whole system. And also, you're usually the first person that people see and the last person that they see when they leave.
That is
So
correct.
anyway, very important. Thank y'all for what you do.
Thank you.
So what else?
Yes.
Tomorrow,
Tomorrow.
we're going to talk about
We're gonna do-
myths or misnomers.
Right.
That should be very interesting, so you'll
Yes.
like that. But there's another thing we've got Friday. We can't announce it till Friday. That's
You
super
better stop talking
exciting.
now, because I don't trust you.
Yeah,
No, I don't trust you.
Please.
Stop talking.
All right. So tune in Friday for something
very big announcement.
exciting and very big related to Singing River.
And our team and the hard work that they've
I
been
think
putting
you give them a
through.
hint.
I'm trying here. I'm trying to lay it in there.
Anyway, very excited about Friday. So be sure and watch on Friday. It's going to be big. So
Yeah,
that's
it's
all I
fun
can
and
say.
exciting day.
Nothing else. Okay, so nothing else.
No.
All right.
Stay singing really strong.
Stay Singing River strong. We'll talk to you tomorrow and Friday and Thursday.
Thanks, y'all.